Taking common painkillers while on the contraceptive pill can increase your chance of blood clots, according to research. The experts explain that the risk is low. However, women taking the pill as well as the pain medication should be informed about the link between nonsteroidal anti-inflammatory drugs, NSAIDs, and hormonal contraception. These drugs are commonly used as pain relief as well as to help with fever and reduce inflammation. The main types of NSAIDs in the UK are ibuprofen, naproxen, diclofenac, celecoxib, mefenamic acid, etoricoxib and indomethacin. According to the Danish study, published in the British Medical Journal, BMJ, risk was greater for women who took painkillers including ibuprofen, diclofenac and naproxen while on combined pills containing progesterone and estrogen. However, the research, including data from more than 2 million women, suggested that the risk is lower for those using progestogen-only pills, often called the mini-pill, implants and coils, as writes Nottinghamshire Live. National medical records were used to track and identify cases of venous thromboembolism, blood clots, among 2 million female participants aged between 15 and 49. All the women involved lived in Denmark between 1996 and 2017 and had no history of blood clots, cancer, hysterectomy or fertility treatment. The study divided hormonal contraception types in high, medium and low-risk groups, according to the links identified with clot risk in previous research. High-risk hormonal contraception included combined pills with either 50 micrograms estrogen or third or fourth generation progestogen, with all other combined oral contraceptives placed in the medium-risk category. Methods including the mini-pill, implants and coil were deemed low-risk. The research found that NSAIDs were used by 529,704 women on hormonal contraception, with 60% of these participants using ibuprofen, making it the most commonly used painkiller, followed by 20% using diclofenac and 6% taking naproxen. Over an average of 10 years, 8,710 venous clots were suffered by participants. A total of 2,715 of these were pulmonary embolisms, with 5.995 deep venous thromboses occurring. Unfortunately, 2.6% of the women died within 30 days of a diagnosis. The findings suggest that using NSAIDs was associated with 4 extravenous thromboembolic events per week per 100,000 in those not using hormonal contraception, 11 extra in those using medium-risk hormonal contraception, and 23 extra for women using hormonal contraception regarded as high risk. The strongest link was identified for diclofenac compared with ibuprofen and naproxen. The scientists state that the study does not prove a link but instead highlights the fact women should be given details about the potential risks. They said, women needing both hormonal contraception and regular use of NSAIDs should be advised accordingly. Factors such as age, education level, pregnancy history, prior surgery, high blood pressure and diabetes, were taken into account when analyzing the findings. Dr. Chana Jayasena, clinical senior lecturer and consultant in reproductive endocrinology and andrology, Imperial College London, said, blood clots are dangerous since they can lodge in the lungs causing breathing and heart problems. Contraceptive medications and painkillers like ibuprofen are essential for many women to avoid pregnancy and cope with period pain. Painkillers and the pill, like all drugs, can occasionally cause serious side effects. But I don't think this study alone should put off women taking either the pill, painkillers, or both if needed. The most important message should be for all women to reduce blood clot risk by smoking cessation and weight loss. Don't miss the latest news from around Scotland and beyond. Sign up to our daily